Over to you, ma'am.
Thank you, Senior. Good afternoon to all. Happy to see you again. Today we are going to learn about the lymphedema. I know this is not a unfamiliar subject to all of you. You might have seen at least once in lymphedema patient. So we have this session going to be very interactive. So if you any things, if you know, you have to share with your chat box. If I ask anything, so this is related to lymphatic system. So we can make this session is interactive. So before, let me share my screen. Can you able to see my slides? Yes. Good. Okay, as I said earlier, this is lymphedema is related to lymphatic system. This is also one of the part of circulatory system. So before moving to the session, I'd like to ask one question. What is lymph? Throughout the lymphatic system, the lymphatic fluids will flow. So what is lymph? Any idea? If you know anything, please put into the chat box. Anybody? No answers? Mahima said fluid. Thank you. Any other answers? So contains lymphocytes. Thank you. It is a clear, Salome said it is a clear fluid flowing, which is some waste which has to flow back. Okay, thank you. So lymphatic fluid is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries, then enters into the lymphatic vessels to lymph nodes. It contains protein, lipids, and water. Okay. So lymphatic fluid is a tissue fluid or an interstitial fluid. It is a clear fluid. It contains protein, lipids, and water. It all that lymphatic fluids is collected with the help of lymphatic capillaries. Then it goes to the lymphatic vessels. Then again go to the lymph nodes and then lymphatic vessels. Finally, it drains to the subclavian vein. Okay. So then when the lymphatic fluid is drained to the subclavian vein, so the vein is also the circulatory system. So lymphatic system is also as a that connecting system. So this is a part of circulatory system. So it contains lipids. The lymphatic fluids contains lipids like protein and water. So the next question is, what are the functions of lymphatic system? What are the major functions of lymphatic system? Any idea? Before moving on to the session, we have to know some idea about the lymphatic system. Then only you will get the concept of management of lymphedema and all. So okay, Meenakshi said immunity. Very good. Any other answers? Removing waste. Shikha said. Any other answers? Okay. Rekha said to fight against the infection. Very good. Maintaining body fluids. Very good. Okay, thank you. So let's see what are the functions. So what are the major functions of lymphatic system? So these are the three major the functions of lymphatic system. The first one is reabsorb excess interstitial fluid. So whenever or wherever the extra interstitial fluid is there, the lymphatic capillaries will take care of that extra fluid. Okay. So if the lymphatic capillary is functioning well, our fluid balance is maintained well. So it helps to maintain our fluid balance. Okay, then so if the that lymphatic capillaries reabsorb the excess interstitial fluid is very important, that way we can able to maintain our fluid maintenance. And the second thing is transport dietary lipids. So here transport dietary lipids also the second function. Here in small intestine we have a lacteals. Here the lacteals will help to drain the transportation of dietary lipids. I'll come to that later. Then the third one is lymphocyte development and the immune response. As one of you said earlier, this is mainly so the help to fight against the infection. So if there is any damage in the lymphatic system, it will affect our immune response, and also that area will get infection freely. So these are the major functions of lymphatic system. So this is our systemic circulation. I know all of you have idea about this. So you can see that picture when that upper part of the body will carry that superior vena cava will carry the deoxygenated blood and drain to the right atrium, and the inferior vena cava collect the deoxygenated blood from the lower part of the body, again drain into the right atrium. With the help of tricuspid valve, it goes to the right ventricle. Then that deoxygenated blood will collected by the right and left lung through pulmonary arteries. Okay. So when the deoxygenated blood goes to the right and left lung, what happened there? The deoxygenated blood, there is an arterial capillaries and venous capillaries are communicating together, and that way that exchanging of blood vessels, that capillaries, that blood, deoxygenated blood and the oxygenated blood together. Okay, so there is a communication between the arterial capillaries and the venous capillaries together there. So after oxygenation, that oxygenated blood goes to the left atrium with the help of pulmonary veins. Then from the left atrium, with the help of tricuspid valve, bicuspid valve or a mitral valve, it goes to the left ventricle. Then from there, with the help of aorta, it goes our body. Okay, get the oxygenated blood. So this is our systemic circulation. So let's see what is our tissue circulation. Here you can, when the venous circulation, and you can see that picture, venous system and arterial system. So arterial system, arterial capillaries carries the arterial that system carries oxygenated blood, and the venous system carries deoxygenated blood. Okay, here you can see that picture, that blue that shade is a venous capillaries, and this is red is arterial system. So this is the green one. So which is the green one? So this is the lymphatic capillaries. Okay, you can see that picture here. When the venous capillaries and arterial capillaries are communicating together, there is a chance of oozing out of fluid or a leakage of fluid into the interstitial space. Okay, so that fluid is carried out that fluid will be absorbed by the lymphatic capillaries, which is the green color. Okay, green color. So wherever or whenever that communication, the arterial capillaries are and venous capillaries are communicating to that, there is a chance of leakage of fluid like substance. That fluid will be absorbed by a lymphatic capillaries. Then it goes to the lymphatic vessels and then it goes to the lymph nodes, then finally drain to the subclavian vein. I hope you all get some idea about how develop lymph into the interstitial space. Any doubts? Any doubts so far? Anybody have any doubts? No. Thank you. Then let's see what is lymphatic capillaries. So this is the lymphatic capillaries. It has a blind end, single layer of overlapping endothelial cells. So you can see the single layer of it is a clustered like picture. It is overlapping to the tissues, more permeable than that of blood the capillary. Okay, so this is more permeable. So even large molecules also that capillaries is able to absorb. Coming to the lymphatic capillaries lacteals. So when I discussed and the functions of lymphatic system, so there is the second major functions of lymphatic system is the transportation of dietary lipids. Okay, here in our small intestine contains special type of lymphatic capillaries called lacteals. We all know that. So what is happening there? From that lacteals pick up the interstitial fluid and also it pick up the lipids and lipid soluble vitamins too. Okay, so that area, so because of they are mixing that lipids and lipid soluble vitamins called, so there that area lymphatic fluids seems like milky color. We can also called as chyle. Okay, so we need to understand that there is a function of one of the function of lymphatic system is the transportation of dietary lipids into the small intestine. So coming to the lymph nodes. So into the in our body, it's around 600 to 700 lymph nodes are there. Okay, so it looks like a small round or oval shape. So you can see that greenish color. Okay, so that located along the pathways of lymph vessels. Okay, so it goes to when the lymphatic capillaries are absorb the lymphatic fluid from the interstitial space, then it goes to the lymphatic vessels. Again, it goes to the lymph nodes. Again, lymphatic vessels, and in between that all way in between the lymph nodes will be there. So I'll come to the lymph nodes, functions of lymph nodes later. So length is from 6 to 25 millimeters. Typically found in clusters. Receive lymph from the many body regions. Okay, so that lymph nodes are ready to receive lymphatic fluids from the regions, that adjacent areas. And then lymph nodes are also found individually throughout the body tissues. So in our body tissue, entire body tissues, that lymph nodes also is there. So come to later. So this is the lymph nodes. So we have to understand that we have it's around 600 to 700 lymph nodes in our body. It located along the pathways of the lymphatic vessels. So how the lymphatic system works? We need to know that how the lymphatic system works. The lymphatic system circulates protein. We already discussed. The lymphatic system circulates protein-rich lymphatic fluids throughout the body. Okay, so that will help to collecting the bacteria, so segregating the bacteria, virus, and waste products. Okay, so along with whenever the lymphatic capillaries are absorb the lymphatic fluid from the interstitial place, the space, also that lymphatic fluids might be contain bacteria, viruses, and waste products also. So after collecting from the lymphatic, interstitial space, what happened is that the lymphatic fluids goes to the lymphatic vessels and then it enters to the lymph nodes. Okay, then it will enters to the lymph nodes. From there, what happened? When the lymphatic fluids is reached into the lymph nodes, the lymph nodes will filter it out the harmful substance. Okay, so when the lymph nodes are fight against the infections, we usually develop fevers. Okay, here one of the important functions of lymph node is to filter it out of harmful substance from the lymphatic fluids. Okay, then the next function is the next role of lymphatic system is the waste of that from the filtered was it flushed from the body and the clean lymphatic fluid drains into the bloodstream. Okay, is it clear to everyone? Clear? Okay, thank you. So this is the lymphatic system that functions. This is how the lymphatic system works. So as I said earlier, when the lymphatic capillaries absorb the lymphatic fluid from the interstitial space, it goes to the lymphatic vessel, then it goes to the lymph nodes. Then from the lymph nodes, after filtration of the waste products, it goes to lymphatic vessels. Again, in between, if there is a lymph node there, again that fluid passes through the lymph nodes, then lymphatic trunk, then collecting duct. From that collecting duct, it drains to subclavian vein. Okay, when the fluids are enter in the subclavian vein, it into that venous circulation. So that is why we called as this is also is a part of circulatory. It is connecting to the circulatory system. So let's see what is lymphedema. So now we understand that what is lymph, what are the functions of lymphatic system, what is the function of lymph nodes. So now we are going to learn about lymphedema. What is lymphedema? So if there is any damage into the lymphatic system, so there is that fluid. If just imagine if a patient diagnosed with a CA breast, if they are going to undergo a surgery on radical mastectomy, so if they are doing the total mastectomy, that time that surgeon will remove the adjacent lymph nodes too. Okay, so you all know that what is total mastectomy. So removal of breast and along the adjacent lymph nodes is called a total mastectomy. Okay, so if the surgeon removes that adjacent lymph nodes into the area, how the lymphatic system works, you can think about that. So here the interstitial fluid production is there, but the transportation is difficult. Okay, so here if there is a pathological accumulation of protein-rich fluid in the interstitial tissue space due to an imbalance between interstitial fluid production and transport. Okay. Here, if there is a normal function there, normal anatomy there. So if you think about ourselves, our lymphatic system is working normal. So whenever the interstitial fluid drain, our capillaries works well and absorb the excess fluid and it goes to the axillary. If you can see my left arm is affected with lymphedema. So here we can my arterial and venous capillary filtration is normal. But when if there is a capillary filtration normal, there is a chance of oozing out the fluid. But I have a lymphatic capillaries, but the thing is, I have no lymph nodes. There is an obstruction. So here, if there is a obstruction in the lymphatic system, there is no way to go up to the fluid. So that is called lymphedema. There is an accumulation of protein-rich lymphatic fluid into that interstitial space due to an imbalance between interstitial fluid production and transportation. Okay. So there are two different classifications according to the International Society of Lymphology says the primary and secondary. Primary is congenital lymphatic dysplasia. Because of the birth itself, there is a malformation of lymphatic system. That's called primary lymphedema. The secondary is anatomical obliteration of the lymphatic system. So now our lymphatic system works well. Tomorrow or day after tomorrow, what is happening, we don't know. If there is any changes in our lymphatic system, there is a chance of developing lymphedema there. Again, secondary lymphedema divided into two, non-malignant and malignant. Okay. So now we understand that lymphedema is not only for the patients having cancer, that non-cancer patients also develop lymphedema. Like non-malignant, like trauma related major road traffic accidents. That time, if that major lymph nodes damaged there, so there is a chance of getting lymphedema. Again, the second one is infection. Frequent infections like cellulitis, iatrogenic surgery or radiotherapy. Okay, so as I said earlier, if we do the surgery like removal of mastectomy, total mastectomy, that time, so if we remove the adjacent lymph nodes too. So that time the patients will develop lymphedema gradually. And coming to the malignant part, primary lymphomas and the secondary recurrence from the one part to another. If there is a metastasis there, that patients also develop lymphedema. So how to diagnose? So this is very, very important. When a patient is complaining of edema, you have to do the proper assessment because other disease conditions like renal problems, respiratory problems, cardiac problems also, if they have some problems there, they can also develop edema. So we have to find out that whether the patient is having lymphedema or not. So when a patient is complaining of edema, you have to take a proper history. The first one is there any unknown cause? The second thing is disease related or trauma related, if there is any recent major accidents happen or not, then any treatment related, and after that you can do to the clinical examination. Okay, so you can take a good history and along with that you can do the clinical examination. So coming to the clinical examination, lymphedema stages are 3. The first stage is pitting edema stage. It looks like an orange peel skin. Okay. So if this stage, you can, when you apply, if you apply finger pressure on that area, you can able to see your finger points there. So this is pitting edema stage. This is the stage 1. Coming to the stage 2, the tissues become fibrotic, little bit fibrotic and hardened. The tissues are not longer soft, but we can able to manage, do some massage. The third stage is considerable, the tissues are considerably hard and sometimes cartilage formations also there. So this is the 3 stages of lymphedema. So this is the only one sign which we have seen in lymphedema patients called stemmer sign. If a patient is having lymphedema on their lower leg, we are not able to pick up the fold of the skin over the proximal phalanx. Usually we are able to, for a normal person, we can able to fold up the skin over the proximal phalanx. But if the patient is having lymphedema, we are not able to lift up because of the edema, we are not able to lift up the fold of the skin over the proximal phalanx. If the patient is having upper lymph lymphedema, the middle finger, you can, that fold of skin, we are not able to lift up over the middle skin, skin. So coming to the diagnostic part, so these are the other diagnostic methodologies. So first you can do the history, proper assessment. You can take a proper history, and then you can do the clinical examination. So these are some other methodologies we can, which we help to find out whether the patient is having lymphedema or not. As I said earlier, there are 2 different classification of lymphedema, primary and secondary. If there is a primary stage, for example, if there is a congenital abnormalities there, so these diagnostic methodologies are helpful. But for a palliative care patients, you can take a proper history, and along with that, you can do the clinical examination. That is enough for a palliative care patient for diagnosing lymphedema. Here, soft tissue imaging, MRI and CT. So if you do that, you can able to determine the extra fluid volume. And if you do the lymph vessel imaging, you can able to detect the abnormalities, whether there is any abnormalities on the lymphatic system, that you can able to find out. And bioimpedance spectroscopy also there. So that will help to measure the interstitial fluid volume. So these you could done in the that primary the stage, like if there is any malformation, if you want to find out that if there is any malformation of lymphatic system there, that will help to sort it out. So otherwise, you won't go these kind of investigations. Most of the palliative care patients are not affordable to do these investigations too. So coming to the problems. So here, just imagine one lymph is normal, the another lymph is huge. Okay, so that day by day the fluid collection is increasing. That skin, that area skin stretch as much as possible. After that, the patients develop pain and discomfort. Okay, and they will develop tightness, heaviness. They are not able to lift their own limbs, and fatigue, numbness, inward mobility. They are not able to move their limbs, and loss of functions too. They are not that functioning well. They are not able to function their limbs well. So that will, if these problems there, definitely it will affecting their emotion, affecting the persons emotionally. So coming to the emotional problems, body image. So one limb is normal, the other one is huge. So that will affecting the patients emotionally, and loss of independence too. They are always depend others. Even if they want to take a chair, they are not able to lift the chair independently. They seek help. They always called others to help them. So that will affect the patients emotionally and psychologically. Loss of change of employment too. So after diagnosis, just imagine after diagnosing this kind of disease or this kind of because of lymphedema, your job is that changing. Can you imagine that? We all working as a nurse, nursing supervisors, nursing superintendent, or a staff nurse, and like that. So after this developing lymphedema, that your job is changing as a that maybe file transfer, something like that. That they may think like okay, they can help that way, but that maybe your hospital think like that, okay, that way we can help that nurse, but it will affect you or a patient emotionally and psychologically because of my disease. My the job is changed, so that we will be affecting emotionally, and difficulty in wearing clothes and shoes. They are not able to if they are willing to wear a ready-made clothes or shoes, they are not able to get it. So that will affect the persons psychologically and socially. Anxiety, depression. So gradually, day by day, the fluid load will be increasing, and after that, that will if the fluid that it may not reduce, the patients will go to depression and social isolation. After getting this type of illness, nobody is willing to see these patients. Society, the social, the neighbors are not willing to see these type of patients, maybe because of this conception of disease, or that kind of things will be there. So relatives and friends are not willing to visit these patients often. So these kind of things affecting the patients emotionally, and constant reminder of disease too. So we know after surgery, it might be developing lymphedema for that patient, but their patient don't know how the lymphedema happened. So they might be thinking that their diseases are spreading through the arm. So when a patients come to lymphedema, it's our duty to explain or educate the patient and caregivers about how to develop lymphedema. So that way we can able to reduce some anxiety level. So they will be anxious about that disease or that lymphedema. So if you give a proper explanation of that lymphedema, so that way we can able to reduce their stress level. So coming to the management part. So any idea on management? Anybody have any idea? So now we understand that what is lymphedema, what are the classification of lymphedema, what are the problems of lymphedema. Any idea? Now we are moving on to the management part. We are going to moving on to the management part. Any idea on management of lymphedema? So Rekha said elevate the lymph. Very good. Massage. Very good. Mahima said massage.
Stockings, wearing of stockings.
We can apply stockings. Very good, Pooja ma'am. Again, Mahima said bandaging. Okay, we can apply crepe bandaging. So you can give proper skin care. Salome said medicines. Medicines for what? Salome? Yes, prevent infections. Try to prevent infections. Very good. Physio. What kind of physio you do, Monica sister? Okay. So all of you have some, thank you. All of you have some idea for managing lymphedema. Thank you for contributing your answers. So let's see how to manage lymphedema. The first one is skin care. So Shikha ma'am said we can prevent infections. Always think about how to prevent infections. So affected limb or affected, if the patient is affecting on the limb, upper limbs, you have to give a that affected area, you can give a special attention because there is a chance of getting infection freely. Here, skin care is very, very important. Let's see one by one. The skin care, massage, compression, bandaging exercise. These are the 4 principles of management of lymphedema. And also intermittent pneumatic compression is also there. I'll come to later on that intermittent pneumatic compression pump. So let's see one by one. So before doing the that massage or a management part, you can do the measurement. So if there is an upper arm affected, you can take measurement from the head of ulna plus 2 centimeter, then again from there every 4 centimeter. Okay. Always give a comfortable position to the patient. Then for the upper arm, head of the ulna plus 2 centimeter. Then from that point, every 4 centimeter. For the lower part, for lower limbs, what you can do is you can take measurement at the ankle joint plus 2 centimeter. From that point, every 4 centimeter. Okay. Then coming to the after taking measurement, you have to give a proper education about the skin care. Okay. After or before, you can do this education about skin care. So apply always, they can apply simple moisturizing cream. So better they could apply after bathing. Okay. Then in between the digits, so there is a chance of accumulation of dirt. So that will maybe if there is a accumulation of nerves in between the digits, it could be developed fungal infection. So always they have to give a special attention between the digits and avoid injections or venipuncture. So if you're giving injections or venipuncture, doesn't matter. But the thing is, if they develop infection that area, definitely there is a chance of getting cellulitis. That patient's area develops cellulitis. So try to avoid injections and venipuncture that area, that affected arm. Avoid ulcers, avoid blood pressure curbs. It will affect the collaterals, and also the patients will feel heaviness and the pain also. If you take blood pressure on that area, after you could ask the patient to the that area, do they have any problem? Do you have any problem? Definitely they said, yes, I have lot of problems. I have my limbs feel heaviness, pain and all after that. So better you could avoid blood pressure checkings also. Avoid injury, keep guards. So you always try to avoid injury. If they are working in a kitchen, if maybe accidentally that injury happen. If there is an injury happen, accidental cut or injury happen, always try to clean that area. If the signs and symptoms, so if they develop signs and symptoms of infection like cellulitis, definitely they can take you have to refer the patient to the physician and make sure that the patient is take 1 course of antibiotics. So if they have developed infection, if they develop infection, they should take antibiotics for that. Otherwise, that whole limb will be affecting cellulitis. Definitely the cellulitis will come. So this is very, very important. And the next thing is avoid carrying heavy weights. So if they are taking heavy weights, what happened? If they are taking heavy weights, what happened? Any idea? No. So if they take heavy weights, what happened is, so our arterial and venous, the capillary filtration is increase. If our tissues, venous and that capillary filtration is increased, what happened? There is a chance of oozing out of extra fluid. So if there is a extra fluid oozing out, what happened? That lymphatic capillaries are ready to absorb the extra fluid, but the thing is, there is no way to go up. There is a blockage. So better they can avoid carry heavy weights. They can carry low weights. Coming to the massage part, there are two different types of massage. The first one is manual lymphatic drainage. The second one is simple lymphatic drainage. The manual lymphatic drainage is one of the trained persons. So trained person means or a nurse or a physiotherapist. If you are able, you should know how much pressure apply on that affected area. But the caregivers or the patient doesn't know how much. If you are giving proper explanation also, after that also they don't know how much pressure is apply on that area. So they can do the simple lymphatic drainage. One of the trained professionals can do the massage on that area, that we call it as manual lymphatic drainage. The simple lymphatic drainage is the caregiver or a volunteer or a patient itself, they can do the massage for the unaffected area, that we call it as simple lymphatic drainage. So let's see how we can do the massage. Before doing the massage, we can do the deep diaphragmatic breathing, deep diaphragmatic or abdominal breathing. So if you are taking deep abdominal breathing, what happens? All internal, as I mentioned earlier, we have around 600 to 700 lymph nodes in our body. So if you're taking deep breathing exercise, all lymph nodes will be stimulated. They are ready to collect the extra fluids. Okay. So then after taking deep breathing exercise, you can stimulate the superficial lymph nodes like neck, axilla, groin. We have a video on that. I'll show you later. So you can stimulate the superficial lymph nodes. Then after stimulating the superficial lymph nodes, you can stimulate the unaffected axilla. For example, if my left arm is affected with the lymphedema, you have to stimulate my right axilla. Okay, my right axillary lymph node is normal, but my left axillary lymph node is already removed. During the surgery, they removed. There is no lymph node in my left leg, that left hand, that is my affected hand. Okay, so after stimulating the superficial lymph nodes, you have to stimulate the right opposite side of the lymph nodes. Okay, active lymph nodes. Then you can do the proximal massage. You can do the pathway. You can massage from that center. Maybe you can push. Our aim is to push the fluid from the affected area to the non-affected area. Okay, so here you can imagine my left arm is full of lymphedema. So our aim is to push the fluid from this area to this area. So from the extra fluid from that affected area, if it will reach to the mid-sternum, maybe in the chest area, in that area, all the we have lot of lymph nodes, they are ready to collect the extra fluids. Our duty to push the extra fluid from the congested area to the non-congested area. Okay, so you can do massage to the proximal part first, and then after clearing the proximal part, then you can go to the distal part. Okay, use gentle pressure. Always, you have to understand that the lymphatic fluid is situated under the interstitial space. That good massage is not needed for this. Our aim is to push the fluid from the interstitial space to that upper part up. You can just the simple pressure is enough. Okay, simple pressure is enough. But for prevention of bed sore, we do massage. If you do that massage, what is our aim there? If you do the massage for a bed-bound patient on a during the pressure, the position change time, our aim is to improve the blood circulation. That way we will do the massage with the moisturizing cream. So here, if you do the good massage to that area, again that edema will increase because the capillary filtration will be increased. If there is a capillary filtration is increased, there is a chance of oozing out of fluid is increased. So here there is a chance of getting more edema. So use gentle pressure. Your gentle pressure is enough to move the fluid from the interstage one part to the another area. So you can see that a picture, that greenish color. There are a lot of lymph nodes in our body. First, you can stimulate the superficial lymph nodes. Okay. So periauricular, submandibular, that subclavicular, and that kind of superficial lymph nodes. Then you can massage the non-affected area. Then you can do the proximal area massage and then go to the distal area. So let's see what are the contraindications of MLD and SLD. So this is very, very important. If there is an acute cellulitis there, they should not do the massage. If there is a cellulitis there, definitely the patients will have pain. So if they have cellulitis, you can give antibiotics for that and give pain medications for that. Once the edema, the cellulitis is reduced, you can do the management. And renal failure. If there is a renal failure there, you should not do the MLD, manual lymphatic drainage, because that fluid overload will be there. If you push fluid to the area, that will affecting the kidney. And unstable hypertension. If there is an unstable hypertension there, you should not do. And then severe cardiac insufficiency, cardiac problem there, and hepatic cirrhosis with abnormal fluid, because, like ascites. If there is a ascites there, you should not do the massage. And superior vena cava obstruction. These are the contraindications. So coming to the bandage. Here, usually what we do is, initially after giving proper education to the skincare, you can do the massage. Then we usually do spiral bandage. After 2 weeks, 1 week or 2 weeks, if they are able to come next week, we ask them to come next week. So after 1 week, we will do the follow-up. If the patient is tolerate on that spiral bandage, then you can move on to the figure of 8 bandage. That is multi-layer bandage. Okay. So our idea after massaging, if you apply that bandaging, so because of the tightness of bandage, that will help to push the extra fluid from that affected area to the non-affected area. That is where we apply that stockings or crepe bandage for the lymphedema patients. For lower legs also, same thing. You can, if the patient is having lymphedema on their lower leg, you can you can do bandaging on the finger, the toes and legs. Like the same way, first you can do the spiral bandaging. After 2 weeks, after 1 week or 2 weeks, you can do the follow-up. If they are tolerating on that, you can go for multi-layer bandaging or figure of 8 bandaging. So after that, you can do the massage. You can do the exercise. So exercise will help to, again, after bandaging, if you do the exercise, again, that will help to push the fluid from the affected area to the non-affected area. That means congested area to the non-congested area. Okay. So you should encourage the patient to the normal function and exercise movement. That movement should be on the, you can, if you have a physiotherapy ball, after bandaging, you can give a physiotherapy ball and ask them to do like this. That will help to move the fluid from the fingers, and then one for wrist and one for elbows and one for shoulder. If they are not able to do the exercise on their shoulder, you can help the patient, or you can train the caregivers to help the patient. Okay. So always start with low to moderate intensity exercise. So not that vigorous exercise. The simple in the exercise is enough. So coming to the intermittent pneumatic compression pump. So I think all of you know that this is a inflatable plastic garment like this. You can see that images. So like this only. So we can do is that your affected limb put into that plastic garment, and we can able to there is a machine called that adjustable machine, that pressure machine is there. So we can able to adjust the pressure there. So you can adjust 30 to 60 the Hg pressure, and duration 30 to 120 minutes. So like that, it always like a BP cuff pressure. When you take a BP, what happened? That will that the cuff will compressing our tissues. No, like the same way this is functioning. If you set 30 to 60 Hg pressure there, so in between the third, if you take adjust that duration is also 30 to 120 minutes. So up to 120 minutes, it acts like this. So that will help to push the fluid from the congested area to the non-congested area. If there is a stage 1 lymphedema there, you can do like this. Otherwise, the patient is not tolerate for this. Okay. If the stage 1 is pitting edema stage, so that time it will help. But the thing is, if they are not affordable, we can't advise for this. So then you can do simple massage and bandaging and exercise. So coming to the complications, there are two complications. One is cellulitis, and the second one is lymphoria. As I mentioned earlier, there is a infection of the skin and the subcutaneous tissue. If there is a cellulitis there, you can give antibiotics for that, and after controlling infection, or after the patient is, you have to make sure that the patient is getting that infection free. So if they are able to maintain their limb well, for example, if the infection is not well controlled, then you can do the proper management. So the second complication is lymphoria. Lymphoria is leakage of lymphedema, that lymph fluid, not lymphedema, leakage of lymphatic fluid from the lymphedema site. That is lymphoria. So here how you can manage is, you can for that oozing site, then maybe the lymphoria site, you can that apply on that dressing pad on that area. Then you can do the crepe bandage. You can apply crepe bandage. That will help to ooze out extra fluid from that area, and that way we can able to manage. Here, no contraindication for bandaging. Here you can do the bandaging. So thank you. We have a video on that. I'll show you a video on we have three video on lymphedema management, part 1, part 2, part 3. So part 1 will be how to do the massage. Part 3, how to do the bandaging. The part 3, simple lymphatic drainage. I'll show you the video. If you have any doubts, please ask me. I will try to clarify your doubts. Okay, thank you.
Management of lymphedema of the arm. Part 1. Manual lymphatic drainage or massage. Rama is suffering.
Any doubts? So we don't have a case presentation today. If you have any doubts, please ask me regarding lymphedema. So, and also you can apply stockings also. So if you are using, if you are suggesting stockings, they should be removed during the night time. But if you are applying crepe bandage, it will not, should not be removed. If the edema is reduced, the pressure, that crepe bandage will loosen. Rather than that, if you are using stockings, once the edema is reduced, that elastic, that stockings will compress the blood vessels, tissues, and affecting the blood vessels. So that is why during the sleeping time, they should remove the stockings. Meenakshi asked the videos. We can't share the videos now. This video we are making for NHSRC. NHSRC is National Health System and Resource Center, who is leading that health care training to the government officials. So for them, we were making these videos. We are waiting their YouTube channel updates. We already shared with them, so they are planning to upload these videos into their YouTube channel. So after that, we will be able to share it with you. So otherwise, there is a copyright issues. That is why we are not able to share it now. So after that, we will share to you. Any doubts? So if you don't have any doubts, we can wind up the session. I hope you all get some idea about lymphedema management. At least what is lymphedema, what are the classifications of lymphedema, how to assess lymphedema and how to manage lymphedema. So, and also you have to understand the complications. There are 2 complications of lymphedema. These all things you have to keep it in mind. And always, whenever you see these type of patients, for example, for lymphedema patients, you can give some education about lymphedema management, and always you can listen their emotions. And if they have any maybe misconception, maybe if they are thinking thinking that the spreading of disease on their arms like that, if you could listen their concerns, definitely you can able to that solve their problems. Okay, so whenever you see these type of patients, you can do the proper assessment, and you can educate them how to develop lymphedema and what are the ways we can able to reduce lymphedema, how we will prevent lymphedema. So during the post-operative period also, you can educate the patient about how to prevent lymphedema. So then they can able to maintain their limbs as well. Then that way we can able to prevent lymphedema. If they are not able to do the proper management, definitely the lymphedema will occur. But even if the patient is having lymphedema, we can able to reduce this way. So try to reduce lymphedema this way. Always take measurement. If you take the measurements, you can take affected and non-affected limb. Then only you can able to measure which lymph is huge like that, and how much difference from the normal and abnormal limb. These all things. If you take measurement for the both limbs, you can able to identify that. So after measurement, during the follow-up time also, you could take the measurement, then only you can able to find out your management is proper or not, your management is effective or not. So if that edema is not reduced, you have to try to identify the cause. Sometimes they can also do the massage. If they are doing good massage, that is another cause to develop huge edema. Okay, again, capillary filtration is increase and there is a chance of huge accumulation of fluid in the interstitial space. Again, the patients develop edema. So that all things you can identify. I hope the presentation is clear. So you have some idea about this lymphedema management. Thank you. Thank you all. We can wind up the session. Thank you for your contributions during the sessions. Thank you once again.